I am Dr. Vishnu Swaroop Reddy, head of the E.N.T department at Care Hospitals. Today I would like to inform you people between 30 years to up to 90 years also we see in our practice presenting with change of voice or hoarseness of voice, especially when the change of voice is there for longer than a month, then definitely their vocal cords should be examined. In the outpatient, after the detailed history, we examine the patient's larynx with a rigid endoscopy or flexible nasopharyngeal to see the larynx, whether it is supraglottis or glottis or subglottis. We can see in the outpatient itself clearly with the endoscope, and once we diagnose that there is a growth on the vocal cords indicating an early vocal cord cancer, we do investigate further, if necessary, to do a CT scan of the neck to see the extent of the growth, and also clinical examination of the neck will indicate whether they have any lymph nodes or not. Once we diagnose the vocal cord cancer confined to the vocal cords, the greatest advantage is they can be treated with daycare laser surgery, which we have been doing at Care Hospitals for more than 20 years. The patient can come in the morning and have the microlaryngoscopy or video laryngoscopy guidance. The biopsy will be done, and once the biopsy confirms that it is a vocal cord squamous cell carcinoma cancer, then we advise the patient the quickest cure, which is using laser. We can remove the vocal cord cancer. Then the patient will be cured. The alternative treatment is 6 weeks of radiotherapy, which is painful for the patients, especially elderly people. So as soon as anyone notices change of voice or hoarseness of voice for more than a month, definitely they should seek the consultation of E.N.T surgeon, who can diagnose early vocal cord cancer, which can be easily cured by daycare laser surgery. Means the patient can come in the morning and can have surgery done, which will be finished within an hour under general anesthesia, and the patient can go home by evening and have normal food. And of course, they need a long-term follow-up for 5 years to see whether there is any further recurrence. We always keep them under 5 years follow-up. Usually first year monthly basis, second year bi-monthly, third year 3 monthly, fourth year 6 monthly. Finally, fifth year we usually, if they don't see any recurrence, we can discharge them safely. We do see these early vocal cord cancer from 30 years age up to 86 years also we have seen, and it is a very good news for the patients. A cancer can be cured within a day, vocal cord cancer. So that's why whoever has hoarseness of voice or any altered voice for more than a month should be examined by an E.N.T surgeon. Once the cancer is diagnosed, it can be cured completely, and there is a great news. And we have been doing this surgery for more than 20 years at Care Hospitals. So If any symptoms, please don't hesitate to contact us for a permanent cure of early vocal cord cancer by single day daycare laser surgery. The usual causes are smoking, alcoholism, and chewing pan, tobacco, and various supari and so many other things are available in the market. I think these are the usual risk factors which should be abandoned completely to prevent any cancer, whether it is oral cancer or laryngeal cancer or hypopharyngeal cancer or esophageal cancer. So the alcoholism and smoking and chewing various kinds of materials like tobacco and other substances should be totally abandoned. Thank you.